U.S., meanwhile, the breaking headline at this hour, a federal judge tonight now blocking Health Secretary Robert F. Kennedy Jr.'s major changes involving childhood vaccines.
Hello, let us tell you what happened this week, because if you haven't heard about this, you need to, and if you have heard about this, you need to understand exactly what it means for your children, for your community, and the future of public health in this country. I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So I've been waiting for this all week to talk about this one, because this is exactly what Dr. Brown and I, AYA Disruptors, exist for, is when power overreaches and the systems actually push back. Finally, So on March 16th, 2026, a federal judge in Boston issued a ruling that sent shockwaves through Washington. U.S. District Court Judge Brian Murphy issued a preliminary injunction that stopped cold Health Secretary Robert F. Kennedy Jr.'s overhaul of the nation's vaccine policy. Good for you. Roll the clip.
The ruling tonight from a federal judge in Massachusetts overturns nearly all of the changes that Health Secretary RFK Jr. brought to the CDC's vaccine advisory panel. The judge sided with medical organizations who sued, blocking changes to the suggested childhood vaccination schedule that included removing shots for rotavirus, hepatitis A and B, meningitis, RSV, and the flu. For health groups like the American Academy of Pediatrics who fought this is a major win.
Major win.
Not slowed it, right? Exactly. Not slowed it down, stopped it. And we are going to break down exactly what happened, why it matters, and what comes next. Because this isn't just a legal story. This is a story about power, about science, and about who gets to decide whether your children are protected against preventable diseases or not.
Yeah, so let's set the stage. You guys remember last year, this whole ruling is against RFK Jr., what he did as HHS secretary. So remember last summer, we talked about this then, Kennedy fired all 17 sitting members of the Advisory Committee on the Immunization Practices, better known as ACIP, claiming it was necessary to reestablish public confidence in vaccine science. So 17 experts, you guys, just gone, just like that. And people who had spent their careers studying vaccines, infectious disease, and public health had been shown the door. And so let's be clear that the people that he replaced them with were skeptics, vaccine skeptics and critics who he filled those seats with. And that's not just reshuffling. That was a hostile takeover, Dr. Brown, of scientific process.
And that newly stacked ACIP, right, that committee, it got right to work. The new ACIP members voted to no longer recommend birth doses of the hepatitis B vaccine, something that's 99% effective. They voted to delay the combined MMR and varicella vaccine, and they voted to no longer recommend the COVID-19 vaccine for everyone 6 months and older. And the irony that we are in the month of March 2026, 6 years after the entire world shut down for COVID, right? So they're leaving this to what they call individual-based decision-making. Hepatitis B, MMR, COVID, these are not fringe vaccines. These are the backbone of childhood immunization schedules that have been protecting generations and generations of children. And it didn't stop there.
Yeah, in January 2026, HHS overhauled the childhood vaccine recommendations entirely, reducing the number from 17 to 11. 6 vaccines just dropped, including the guidance on rotavirus, influenza, and hepatitis A. And here's the part that you need to really hear and we want to talk about is the reduction. This whole thing was hinged on the directive of your president, Trump, instructing Kennedy to align the U.S. vaccine schedule with those of other high-income nations. And that came from the top. It was coordinated, orchestrated. It was a systemic dismantling, not a review, not a reassessment, a dismantling of decades of evidence-based public health infrastructure.
Public health infrastructure.
The PSI, yes.
Right.
Mm-hmm. I got
right.
it. Mm-hmm.
The PSI. So now the medical community didn't just sit quietly. And Sonya, as a physician yourself, right, we know that this one hits different because these are our colleagues. These are organizations that we trust, the institutions that set the standards that we practice by. And they fought back hard. hard and fast. The plaintiffs included the American Academy of Pediatrics, the American Public Health Association, the American College of Physicians, the Infectious Diseases Society of America, and the Society for Maternal Fetal Medicine, and several state-level public health organizations. So basically the entire establishment that follows evidence-based science.
The people that we trust, right? These aren't fringe groups. These are a foundational institution in American medicine. They've been around for a while. And they went to court. We're so proud of them, arguing that Kennedy wasn't just bad policy. It was illegal. Hello? Illegal. The lawsuit argued that Kennedy's appointment of vaccine skeptics after firing 17 previously appointed members bypassed the scientific process and did not follow proper administrative procedures.
And the government's response? DOJ attorneys, they argued that the plaintiffs and courts had no authority to review Kennedy's decisions, saying in their own words, quote, "What they want this court to do is supervise vaccine policy indefinitely."
In other words, they said, trust us, stay out of this. This is our call. And the judge said, yeah, no, that's not what's going to happen. Judge Murphy's ruling was decisive and it hit on multiple fronts. The judge found that the new member appointment violated the Federal Advisory Committee Act and that the law that requires panels like the ACIP to maintain a fair balance and to avoid inappropriate influences by both the appointing authority and special interests.
Fair balance, free from inappropriate influence. That is the law. And the court said that RFK Jr. broke it. So let's roll the clip.
RFK Jr., a lifelong vaccine skeptic, told Congress he wouldn't change the existing vaccine recommendations and did so anyway, leading to protests outside the CDC. Last summer, he fired experts who make the recommendations and replaced them with 13 members more aligned with his views. Tonight, the judge is also suspending all 13 of those replacement members, writing that there is a method to how these decisions historically have been made, a method scientific in nature. Unfortunately, the government has disregarded those methods.
So Dr. Brown Murphy acknowledged that many of the new members did have extensive expertise in the different fields, but he also found glaring gaps in their expertise relevant to the actual function and the task of that committee.
Interesting. So you can't just pack a committee with people who agree with you and call it science, even if they're experts in different things? I mean, that's just not how it works. And that's not how any of this works.
He didn't just block the appointments. He totally invalidated everything those illegally appointed members had even voted on. The ruling invalidated the ACIP votes and reduced the routine childhood vaccinations and downgraded their recommendations for the 6 disease. He said, get out of here with that.
Gone. Legally gone. Moot. Like they never even happened.
And now the vaccine schedule, the judge found that the CDC had bypassed the ACIP, was both technically and procedurally a failure. And so an abandonment of technical knowledge and expertise embodied by this committee. So the judge was saying you had a process, a rigorously, legally protected process, and you chose to walk away from that process.
Exactly. The injunction says the revised vaccine schedule from January 5th overturns the May 2025 secretarial directive of the COVID-19 vaccine recommendations and reverses the downgraded hepatitis B vaccine recommendations from the December 2025 ACIP meeting. So that is comprehensive. And guess what? That is what accountability looks like. So let's talk about this in the real world, because that's really what our listeners need to know. What does this mean for your families today, right now? And so here's the bottom line. All vaccine recommendations in effect at the end of Biden's presidential term remain currently in effect. Boom. That's huge, right? Any changes made by the CDC, ACIP, or HHS more broadly since May 2025 are not currently valid. They're not valid. So that's also important because of coverage, right? Insurance coverage. CMS and the Vaccines for Children's program are legally required to cover all the vaccines that they were covering as of January 2025.
That's huge. The Vaccines for Children program, it's not a small thing. And about half of our nation's children receive these vaccines through these programs. Half. And their access is now protected. And the ACIP itself, the plaintiff's attorneys said plainly, ACIP are currently constituted, cannot meet. And so how can a committee meet without nearly the entirety of this membership? They're just meeting sort of half board, I guess. An ACIP meeting was scheduled for Wednesday and Thursday, was immediately postponed at the direct ruling of this outcome. So shut down, Dr. Brown, by the court order because the process was broken from the start.
So now the administration's response, and Sonya, I need you to brace yourself here, Dr. Sloan.
There's no telling what I'm going to say. I'm just go ahead.
So the HHS spokesman, Andrew Nixon, said the department expected the ruling to be overturned and characterized the decision as an attempt to prevent the administration from governing. You don't say.
An attempt to prevent the administration from governing. That's what you call federal court upholding the law that they broke over and over again. That is what they call medical organization finally standing up and defending children and being validated by the court system. True balance of power, right? That's what you call accountability. It looks like to this administration an obstacle.
And one of Kennedy's own ACIP appointees, Robert Malone, called the judge a rogue judge, claiming strong grounds for appeal.
I'm sure it's going to be appealed. Let's be honest. Everybody knows that's coming, right? This is just a preliminary injunction, not a final verdict, and the case does continue. But here is what cannot be understated. A vaccine expert who has been removed from the panel by Kennedy said it best. ACIP had fallen into such despair that everyone had started to ignore it.
But its proclamation still had legal heft. The court ruling puts public health back on the right path. Back on the right path. And that's exactly where we need to stay. So here's what I want people to take away from this moment. This is bigger than one ruling, right? This is a pattern, a deliberate effort to replace science with ideology at the highest levels of our public health infrastructure. And listen, this is what's done in the administration, be it the East Wing, immigration policy, basically anything they want to do, they do it first and then get to the courts. So
that's ridiculous, but thank God for the courts, right? Finally, some response. And so these, you can fire an expert, you can replace it with your allies, you can change the rules, you can skip the process to move fast and hope nobody notices. But people noticed, all the organizations noticed, we noticed.
The American Academy of Pediatrics noticed, the infectious disease doctors noticed, the maternal fetal medicine specialists, the doctors that actually protect high-risk pregnancies, they noticed, and federal courts said, basta, not on our watch, not on our watch.
I love that. And so for those of us who work in medicine, who have spent our careers trusting the process built on evidence and rigor and transparency, this ruling matters. The vaccine policy isn't a political opinion. It's the product of decades of research, clinical trials, surveillance data, and expert review. You don't just get a shortcut that because you have a title.
You know, in our communities, the communities that look like me and you, Black communities, brown communities, underserved communities, those are poor communities that can be all colors. They have always been the most vulnerable when public health systems fail. And we've seen it. We lived it. I mean, there's measles outbreaks. Kids are dying of whooping cough. It's crazy. And we will not be quiet when those systems are being gutted. And so we're watching, we're staying informed, and we're telling our patients, our families, our congregations, our communities, your children's vaccines are protected right now. The schedule stands and the science stands.
And so we're not done fighting, you guys. We are empowered, we're disruptive, and remember, your voice does matter, it counts. We're AYA, contributors of MeidasTouch Network, and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Thanks, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.